Hip replacement, $70,000. Angioplasty, $100,000. And heart bypass surgery, more than $200,000. A healthcare system that liberates the marketplace, frees doctors and employers, and gives patients more control over their own healthcare dollars? Priceless.
It's the biggest mistake we've made in this country and all over the developed world. We forget that when people don't pay with money, they pay with something else. They're paying with time. And these non-price barriers to care, all of the waiting, are more important than the money price of care, even for low-income people. Basically, we have to liberate people. We have to liberate the patient, the doctor, the employee, the employer. This book is all about freeing people up to use their intelligence, their creativity, their innovative ability to solve our problems.
Priceless is the title of John Goodman's new book, published by the Independent Institute. The book, a successor volume to Dr. Goodman's bestseller Patient Power, offers no-nonsense private sector solutions for healthcare reform. Solutions that are truly priceless.
Nobody sees a real price in healthcare, no doctor, no patient. You know, poor people with food stamps go into a grocery store, they pay the same price as you and I pay, they never have a problem with access. Greg, the whole problem in healthcare is we have completely suppressed the market. Nobody ever sees a real price for anything. No doctor, no patient, no employee, no employer. The only way we're going to solve the healthcare crisis is by restoring the price system.
NCPA senior fellow Devin Herrick says if Obamacare isn't repealed or replaced, it's likely that businesses, especially smaller businesses, will no longer be able to afford health care coverage for their employees.
Really, any employer that wants to be competitive would find a way to quietly drop their health plan, pay the penalty, and just direct their workers to the exchange. And that's really not good for taxpayers, and it's not good policy, I'm afraid. I don't really see anything affordable about the Affordable Care Act.
The solutions in Priceless also help frame the NCPA's vision for health care reform that includes practical, realistic, universal coverage that requires no mandate. It's a health care contract with America. Dr. Goodman testified before the House Committee on Oversight and Government Reform and on national television that we must free the health care market.
Well, right now we have a bureaucratic, wasteful, inefficient system, and when government nationalizes it, it will become more wasteful, more bureaucratic. And the only way out of our problems is to free the doctors and free the patients, let them use their intelligence and creativity to solve their own problems. We're not going to solve these problems from Washington.
The other primary issue in the 2012 election campaign: jobs. NCPA Policy Chairman Mike Whalen appeared on a special Fox News Channel report on job creation. And the NCPA also held a Capitol Hill briefing about how to break the barrier of 8% unemployment. NCPA senior fellows Pam Villarreal and Bill Connolly told Capitol Hill staff and national media in attendance, promoting and encouraging job creation is the best solution for bringing long-term unemployed workers back into the job market.
I think the most important thing is we have a system that is not meeting its initial goals, and as a result, we have many long-term unemployed who are getting discouraged, and all the talk about there are no jobs available further discourages them.
We're letting today's discouraged workers fall off a cliff.
And NCPA distinguished fellow Bob McTeer told CNBC that as we approach the watershed 2012 election, we face an economic dilemma. Further stimulating the economy could make our fiscal situation even worse.
We need to put fiscal measures in place, and we need to put entitlement reforms in place that will work over the next several years. We don't need any austerity right now. It'll tip us into a recession.
The NCPA also hosted Fox News analyst Judge Andrew Napolitano at a recent Hatton W. Sumner's Foundation Distinguished Lecture. Napolitano, appearing shortly after the recent Supreme Court decision on Obamacare, expressed surprise at the court's decision, but also questioned the benefit of government intrusion in the healthcare market.
The same government that can't provide booze and hookers to truckers in a desert wants to run health care.
The NCPA also hosted noted academic John Lott to discuss his new book, Debacle, about the lack of job growth during the Obama administration and what needs to be done to regain America's future. Another recent NCPA Policy Forum and Author Series event featured conservative policy advocate David Horowitz. Horowitz told attendees that, contrary to popular perception, left-wing organizations are far more numerous and much better funded than their their conservative counterparts.
There are 75 conservative foundations, and they have $10 billion in assets. There are 115 so-called progressive foundations, left-wing foundations, and they have $104 billion in assets. In other words, they're 10 times the size.
For more information about these important issues and the NCPA, please contact us. You can call us or send us an email. We want to know what you think. And thanks for your support of the NCPA and the important work we're doing.